I want to get to your coronavirus questions now. Dr. Joseph Fair is joining us this afternoon, a virologist, epidemiologist who's tracked viruses such as Ebola and SARS. He is also an NBC News Science contributor. Dr. Fair, thank you so much for joining us this afternoon. We want to jump right in. We've seen these local cases, as expected, continue to surge in the tri-state. People all doing their part with our social distancing, but so many folks are wondering when we're going to start to see the results of our efforts here. Can you speak to that?
Well, you know, as far as the peak, we've talked about the peak a lot on the curve, and we've talked about flattening the curve a lot. Without diagnostics everywhere and readily available for everyone, we actually have no idea where we are on the curve. But I think Governor Cuomo is correct in saying anywhere from 21 days to 6 weeks, we're actually going to see the peak here in the New York City and tri-state areas.
And that puts us at mid-April. So many people waiting for that date. Let's talk about the masks now, because I'm sure you've seen them as you've gone out and about. I was just in the grocery store in Bergen County this week, and a lot of folks wearing the masks. So two-part question here. Does it matter what kind you wear, and also can you re-wear them? Is that safe?
Well, it depends on what kind of mask you're talking about. So there's the regular kind of surgical mask, which you'll see kind of loosely fitting on someone's mouth, and that's what a dentist or a surgeon would wear. Mostly they wear that to protect others when they're, have you open on a surgery table, for example. And CDC guidance is actually changing on mask, and it's expected to change any day now. Before, and we used this from the experience with SARS, those masks were not seen to be incredibly effective at blocking transmission. But that being said, now they are recommending or considering changing their guidance to wearing masks, and it would be the surgical ones, not the medical ones, because we're reserving those for healthcare workers. But to block your actual droplets from expelling from your mouth and infecting others while you may be asymptomatic.
Mm-hmm. Can you, and to the second part of my question, can you re-wear the white surgical mask, the looser fitting ones?
You can rewear them. It's not ideal to rewear them, but you can, especially if you're asymptomatic. If you don't know that you're sick, or if you're not sick, it's not going to make you even more sick to keep on wearing them. It's not ideal, like I said, that you would rewear them. There's ways to naturally disinfect them if you can put them near a window where they're going to be exposed to sunlight, for example, especially the interior side that would come into contact with your mouth. The sunlight itself and the UV light in the sunlight would disinfect it.
Oh, good to know that, because I know a lot of people want to save those, ration those out there. All right, Dr. Fair, we thank you once again for joining us.
Absolutely.